This is a video showing live OCT images while a subconjunctival injection is performed. On the left side, we can see the surgeon's view through the microscope, and on the right side, we can see on the top and on the bottom the horizontal and the vertical cross-section views. As the injection is being done, we can clearly see the Tenon's capsule getting hydrated. And it's very interesting that there's actually no one plane that is being created. You can see the liquid just diffusing and hydrating the entire tissue and expanding all the tenons, which we can see with all these little irregular areas on the live OCT image. Also nice to see, as the eye is being moved with the cannula, the insertion or beginning of the tenon close to the cornea in the front of the eye, and we can clearly see this hyperreflective cavity or space that demonstrates the lack of tenon near the limbal area and how tenon actually starts 2 to 4 millimeters behind the limbus. When we see these images, I think it's very easy to visualize what we mean with tissue or interstitial resistance that can be present at the end of the implant, and it is very highly likely to have an implant that is entangled or trapped in these tenos layers when we do the implantation. This also helps us understand why the maneuvers we used to do in the past, where we tried to straighten the implant using a cannula or a hook, was not effective because we were not taking care of the root cause, which was the implant being cut in tenon. Hence, primary needling, opening the conjunctiva, or whatever method you will use to create this space is the ideal way to ensure that the implant is free and mobile and out of tenons, ensuring the implant outflow will not be restricted by tissue.